Is infection a risk after total knee replacement for OA? Have you ever wondered about the risks associated with total knee replacement surgery for osteoarthritis? One of the concerns that often comes up is the possibility of infection. Let's break this down to understand the facts. Infection is indeed a recognized risk after total knee replacement surgery. While the overall chance of developing an infection is relatively low, it is still a possibility that can lead to serious complications. Infections usually occur when bacteria enter the surgical site or attach to the artificial joint components. Unlike natural tissue, the artificial knee does not have the same immune defenses, making it easier for bacteria to multiply. Most infections tend to develop within the first 2 years after surgery, with many occurring in the initial months. However, it is important to note that infections can also arise years later. This means that even after a successful surgery, vigilance is necessary. Certain factors can increase the risk of infection after total knee replacement. For example, underlying health conditions like diabetes, obesity, and immune system deficiencies can make a person more susceptible. Additionally, peripheral vascular disease and rheumatoid arthritis are also known risk factors. If a person smokes or has had previous surgeries or infections in the knee, their risk may be further elevated. Treatments that suppress the immune system, such as corticosteroids or chemotherapy, can also increase the likelihood of infection. So, what should you be on the lookout for? Symptoms of infection may include increased pain or stiffness in the knee, swelling, redness, warmth around the wound, drainage of fluids, fever, chills, and fatigue. Early detection is key, so if you notice any of these symptoms, it is important to contact your healthcare provider promptly. Total knee replacement is a common and effective surgical intervention for osteoarthritis, especially when other treatments have not provided relief. However, it is essential for patients to be aware of the risk of infection and take preventive measures. This includes managing any existing health conditions, maintaining good hygiene, and closely following postoperative care instructions. In summary, while infection is a possible complication after total knee replacement for osteoarthritis, being aware of the risk factors and symptoms can help in managing this concern effectively. Taking proactive steps can lead to better outcomes and a smoother recovery process.